So here you are watching drug-induced sleep endoscopy with monitoring in a 60-year-old male with history of snoring, choking, daytime sleepiness. His body mass index is 29, so he is little overweight. He's got a DNS on the left in the higher part, as you can see here, and on the right in the lower part. And bilateral turbinate hypertrophy has got some sinusitis, bilateral sinusitis on the CT scan. You can see the turbinates are also enlarged. Allergic issues are there. His AHI on the sleep study is only 4. It's not a case of obstructive sleep apnea or a very mild obstructive sleep apnea, mainly upper airway resistance. And no, there are no adenoids. The salpingopharyngeal folds are at least grade 1 by Agrawal's classification. You may even call them grade 2 because they are more than 75%. And at the base of 77, you can see a complete collapse. So obviously AHI of 4 does not match into what we are seeing now. And that's a level 3 study. So many a times happens that patient does not sleep well. His palate is pretty long. You can see a predominantly lateral collapse. No tongue base, no epiglottis. You can see the tonsils coming together very clearly. The tonsils, upper pole of the tonsils coming together and touching in the base of the uvula. But it's predominantly a lateral collapse because of the tonsils. The only thing is that when you do surgery only for lateral collapse, then it will start collapsing anteroposteriorly. So obviously you have to take care of both AP as well as lateral collapse. So the correct surgery for him is a suspension bridge pharyngoplasty for both AP as well as lateral, along with salpingopharyngeal fold channeling. Right. So I would grade them as grade 1, 25 to 75% is what I'll actually grade them. Grade 1 salpingopharyngeal folds. Septoplasty, turbinoplasty, and sinus surgery definitely will be very important because is majorly a case of upper airway resistance. You can see his collapse is incomplete. It's not complete. Therefore, the AHI is 4, but it's multi-level. So, anatomical obstruction sites here it's multi-level. You cannot only do the nose, only do the salpingopharyngeal fold, only do the soft palate. But you can see he's mainly snoring, right? It's not persistently obstructing. Therefore, the AHI is less. So, as I always say, AHI or the sleep study shows physiology, and DISE CT scan they show anatomy. So, anatomy is shown by the CT scan, the physiology is shown by the sleep study, and DISE is actually combination of anatomy and physiology because you do it at the sleeping level. All right. Thank you for watching.